Hey everybody. Today I want to talk about breathing in postures because it's important to recognize that when we breathe, we do it with muscles, okay? And when we do postures, we also do that with muscles. And so if we're not careful, we can create conflict in the way that we're breathing and the way that the postures ask the body to function. And the biggest thing to keep in mind is that to use your abdominal muscles, which are the biggest group of muscles that get engaged when we breathe, to engage the abdominal muscles, exhale. So if you do this with me, exhale as strongly as you can. If you exhale really strongly, and then you feel your abdominal muscles. Your abdominal muscles get quite engaged because one of their big functions is to exhale. And the exact opposite is true, which is that if you inhale strongly and you check your abdominal muscles, they are going to be naturally relaxed, okay? Because that's how our body lets the ribs lift, and it's how the body lets the diaphragm come down and the abdominal contents move around. So, roughly speaking, to engage the abdomen, exhale, and to relax it, inhale. And so, when we look at any posture that uses the abdomen, whether we want to have it relaxed or engaged, you can synchronize that with how you breathe. And some of these things we do naturally, and some of them are common in postural instruction, but some of them are not. So let's just talk about a couple big ones. Okay, the first big one is a plank posture, which a plank is done on the hands and the feet like this. And this position requires a fair bit of abdominal engagement because if the abdomen were not engaged, the pelvis would fall toward the floor like this and you would do a back bend. So to hold the body in plank, you need a good amount of abdominal strength to hold the pelvis and the ribs close together. Now, you may notice that it's hard to breathe when you do plank. Okay, this is not because you are weak or because you're doing it wrong. This is because when you hold a plank like this, your abdominal muscles are contracted. And whenever you want to inhale, your abdominal muscles wants to relax. And so as we hold ourselves in that position, the body essentially can't breathe very well. And so you'll find that if you're in plank and you try to take a deep breath, it's almost impossible to do, and that a far better solution is to breathe very, very, very small and let the abdomen stay firm the whole time. So you can hold the breath out, which will encourage the abdomen to contract, and then keep your abdomen tight because that's how you do the posture, and breathe tiny, tiny, tiny little breaths. And that way, your abdomen can stay tight the whole time. Whereas if you try to take deep breaths, you're going to get conflict between the breath and the posture. An example of the opposite, like a posture where we want to relax the abdomen, is any back bend, like Cobra posture. And so in Cobra posture, we'll lie on the belly and we'll bend the spine backward. But to bend the spine backward, you actually want to relax your abdominal muscles. So you do this on an inhale, because by inhaling, you will naturally relax the abdominal muscles. So this is why when you do Cobra, the most common instruction is to inhale and come up. Because when you inhale, you will naturally relax your abdominal muscles. If you want to play a little game and play with your body, you can try exhaling really strongly and feel your abdomen contract, and then come up into Cobra. And you'll notice that the abdomen stays contracted, and it's a lot harder to do. So this is an example of inhaling to encourage abdominal relaxation so that we can do a posture like Cobra. Let's look at one more posture or exercise that uses the exhale to help you engage the abdominal muscles. This is the torso lift, where you lie on your back and pull your ribs towards your pelvis. Sometimes people do it with their arms overhead like this, or you can do it with your hands on your legs like this. But the goal is to strengthen the abdominal muscles. And so we want these to engage, and so we do this on the exhale. Because exhaling helps our abdominal muscles engage. Now, if we tried to do this on the inhale, it would be very, very difficult, because inhaling asks the abdominal muscles to relax, while the posture is asking the abdominal muscles to contract. Okay. So that is, we end up feeling confused in the body, like your body doesn't want to do what you're asking it, because you are asking it to do two very different things. Probably the most confusing use of breath and abdominal muscles is in leg lifts, where, because of the nature of a leg lift, where your leg will go up and down, oftentimes the up part gets instructed as an inhale and the down part gets instructed as an exhale. And this is probably just because we think of inhaling as a rising motion and exhaling as a descending motion. But when we think about how to engage the abdominal muscles, we actually want to exhale for all of the time that we're asking the abdominal muscles to engage. And so when you're doing something like a leg lift, you actually want to exhale as you lift the leg up. And then ideally, you will keep exhaling or keep the breath out as you lower. And then while you're setting up for the next round, you can inhale a little bit and then do it again. You'll exhale as you lift up, because you're going to ask the abdomen to engage. And then you either hold the breath out or you continue exhaling as you lower the leg, because all of this requires abdominal engagement. So try that a few times. Lift your leg as you exhale, and then keep exhaling as you lower it. It's very different in the body from inhaling when you lift the leg. So that's probably enough for today, but I wanted to emphasize and try to clarify that when you breathe, you are asking your body, and specifically your abdominal muscles, to do something, right? When you inhale, you are asking your abdominal muscles to relax. And when you exhale, you're asking your abdominal muscles to engage. And so if you are doing a posture where you want the abdominal muscles to relax, it will be best to do that while inhaling or after an inhale. Whereas if you are doing a posture where you want the abdomen to contract and be engaged, it is going to be best to do that on an exhale or after an exhale. And at any point that you want the abdomen engaged, breathing deeply in and out is going to make that really hard, because you're going to be asking the abdomen to relax, engage, relax, engage. Okay. That's enough for now about how the breath and posture are interrelated.